Yes, this is our A&P lab instructor cat dissection, which is really comparative anatomy. We want the students to understand the muscular system of the body, but from a perspective of the cat. It is human anatomy that we're studying after all. When we get the cats out, we are in good shape because they've already been skinned. The fact is, the manual will lead you into skinning the cat. And a lot of instructors will go right into showing their students how to skin the cat when it's already been skinned. So, obviously we want to skip the first 2 pages, move on with this dissection, paying attention to the fact that you want your students to have an apron, to have gloves, preferably something to cover their eyes. Don, can you show me that thing right there? Within reason.
It's a little crazy.
Yeah. There is a proper way to open up these bags once you've set up your tray and you've accumulated the utensils you need. Well, you need a pair of scissors to open up the bag, a probe, some tweezers, and other possible accoutrements. The one tool that we need that we want to be careful with is the scalpel, with the blades being sharp. The worst are when the blades start getting dull. You got to be careful not to cut yourself. So we have our tray set up over on the side. We're going to take our cat and we're going to open up the bag carefully from the top. Removing the top of the bag, we're going to be careful not to spill the juices out. We'll do it over the sink. So all of this will be done over the sink. And we'll bring the cat out of the bag, again, keeping all the fluids in the bag and saving them. Because the cat's going to go back in the bag, in those fluids, and it will keep it hydrated. The worst thing is a dried out cat, especially if you lose the embalming fluid, formalin, bacteria can set up. And you've got not only a dry cat, but a smelly cat. So let's move on to what a cat would look like. Once we've initiated dissection, we're going to start with the upper thoracic area. In A&P 1, we start with talking about the cavities, the body cavities. So we want to differentiate between for the students between the thoracic cavity and the abdominal pelvic cavity. Show them the diaphragm as we go inside. And this one is not dissected.